Well, good evening, everyone. And this is Reverend Kendrick Curry of the Pennsylvania Avenue Baptist Church. And we're here today with an exciting program to begin to talk to some doctors that are from GW, that's George Washington University Hospital. And we're excited to describe and discuss matters of impacting DC around COVID-19 and talking about testing and telemedicine. I will have each one of the doctors introduce themselves briefly, and we will then go into a presentation that will allow us to discuss everything from the statistics to telemedicine to testing, even unto what do you do when you live with someone with COVID-19. So I would just like to ask, and we can start with Dr. Batra, if you would, please introduce yourself.
Sure, my name is Sonal Batra, and I'm an emergency medicine doctor at George Washington University Hospital, as well as at United Medical Center.
All right, thank you for joining us. Dr. Powell.
Yes, sir. My name is Natasha Powell. I'm also an emergency medicine physician working with George Washington University, and I also work at the Veterans Hospital. I'm a local girl. I grew up in the area in Prince George's County.
All right. Well, welcome and thank you so much. Dr. Meltzer?
Yeah, hi. Thank you, Dr. Curry. So great to be here. So great to be talking to your community and the audience. We're real excited to communicate what's going on now with COVID and answer all the questions that are going on. And thanks so much for convening this.
All right. Dr. Sicker?
Hi, I'm Neil Sicca, also an emergency room doctor at George Washington University. And I recognize a couple blue HealthDesk shirts. You guys have seen probably all of us out at the HealthDesk activities working with Pennsylvania Avenue Baptist Church. It's good to be with you all again.
All right. And certainly last but not least, Dr. Alam.
Yeah, hello everyone. My name is Ahmed Alam. I'm an emergency physician and also a teleinformatics and digital health fellow at the George Washington University. And I've seen a lot of you guys if you attended previous events, and we're so excited to be with you again.
Well, we're excited to have you all, and we are certainly excited to have our audience here viewing with us, and it's going to be a great time. We have great information in store for them, and we're just looking forward to having more and more webinars that will reach into the community and touch people where they are. I do want folk to know that on the webinar, you will be able to view this webinar again on Facebook Live, or a variety of different pages through the HealthDesk. You'll be able to view the webinar again, also through the Pennsylvania Avenue Baptist Church's webpage. You'll be able to go there. And so we want this information to be out in the community and get a whole lot of likes and have some intimate discussion with regard to this pandemic that is wreaking havoc in our nation. So I would like to go ahead and get started with our presentation tonight. And I believe, Dr. Meltzer, you're up.
Thank you so much for the introduction. I appreciate this so much. So we're going to talk about a couple different aspects of the coronavirus crisis that's going on. Each of us will take a couple minutes to describe, and then hopefully we'll have time to answer questions too. For me, I'm going to be talking just about what's going on in DC, sort of from a bird's eye view. And one thing is that DC DOH, I think, is doing a really good job of tracking the cases. So a lot of our information is coming directly from them, and we've been working with them pretty closely. And you can see that data, the same data that I'm looking at, you can check out, and you can check it out every day. It's updated at coronavirus.dc.gov. And I just took a few of the pieces of what's on that website to show in this slide here so I could communicate with everybody. I think one thing that everyone should know is that the cases are still going up in DC, and that we're still seeing new cases every single day. So we're seeing 150 to 200 cases every single day. And that's that blue line you see in that bottom corner. And that hasn't slowed down for as far as we can tell. We really want to see that start to slow down until it's almost flat. That's what we talk about, flattening the curve. So we're happy that it's not going straight up like a skyscraper, but we are still seeing a steady increase. So it looks like patients who are getting it are still passing it on to other people. And that's the whole point about social distancing, is that you get the disease, and the way you pass it is you're passing it to somebody you're interacting with. We're still seeing people dying. And as of April 20th, and I'm sure this number is up now, 112 DC residents. I think we're at 120, 130 now. And every one of those deaths is a tragedy. And we're doing everything we can as doctors, and I know as a community too, to decrease the transmission and hopefully decrease the number of people who have died. One of the saddest things about what's going on with this is how the last 2 weeks we've really noticed that patients in poorer communities are being affected more severely. And that's something that I find very distressing. And we're not 100% sure why. Patients with more comorbidities, perhaps, patients who find it harder to socially isolate if you have more people in your house, and then also some of the jobs that people do. If you're working in a grocery or driving a bus, it's harder to socially isolate. So we just wanted to just talk about some of the challenges that people are facing, and we really want to just talk about how we can help people both socially isolate and then when they should call the doctor, and what we can do to help them as doctors, and also through HealthDesk. You can also call DC if you need help. There is a COVID-19 hotline. You can either call through 311 and you'll get through one of the people in the COVID hotline, either a doctor or a trained operator, and or you could call 1-888-349-8323, and we'll put this information on the website also if you need support with food or with other daily necessities. So thank you so much for hosting, and I'll pass this off to our next panelist now.
All right, Dr. Batra.
Sure. So I'm going to talk a little bit about what you should be looking out for in terms of the symptoms of COVID-19. So this is a long list of a number of the symptoms, but it's important to know that any one person with COVID-19 can have one of these. They might have all of these, or they actually could have none, because we're finding that some people are what we call asymptomatic, meaning they seem like they have the virus that causes COVID-19 when we test them, but they actually don't have any symptoms. The common symptoms, the classic ones we've been talking about for a few months now, are the three listed at the top. So fever, a cough, usually a dry cough, but sometimes people are bringing up phlegm with it, and shortness of breath or difficulty breathing, like you're doing your normal routine and you can't catch your breath, or you can't walk up the stairs or as far as you normally could without feeling short of breath. Oftentimes in the beginning, people don't necessarily have a fever, they don't necessarily feel short of breath, and it just starts with that cough, but then continues to get worse. There's a lot of other symptoms that can come along with it, and that's why it can be difficult to tell if this is COVID-19 that you have, or it's another cause of the common cold or the flu, or sometimes it can even be confused with allergies. But other things people have noticed is body aches or muscle pain, headache, sore throat, some tightness in the chest. And then some of the things that we've been talking about lately that seem a little bit more pointing specifically to COVID-19 are loss of taste or smell. And a lot of people also have gastrointestinal symptoms, so nausea or diarrhea. It's important to note that not everyone has those. Not everyone has loss of taste or smell. We don't know how many people with COVID-19 do have them, but it looks like some people certainly have those symptoms. And again, oftentimes this can start mild, so you can feel okay for a couple of days or weeks even, and then it can start to get worse. So it's important to know when to call a doctor, and I'll show you some of those things on the next slide. At this point, testing is becoming pretty widely available in DC, and I know some of our next panelists are going to talk about how to get tested. And it is important for us to understand, as a whole city and as a whole country and world, how many people are infected. So we do encourage you to contact your doctor if you have any symptoms at this point. The best way to do that is to call ahead. So if you have any of the common symptoms, fever, cough, shortness of breath, but even the other ones I mentioned, stomach problems, if you have chest tightness, certainly, then contact your doctor. And if you don't have a doctor, as Dr. Meltzer mentioned, you can call 311 and get connected to a telemedicine appointment. And we'll talk more about that, but that could be over the phone or through video like this. If you feel really bad, like you would have gone to the emergency room even prior to this whole pandemic, then you should still call 911. So that's really if you're feeling really short of breath, if you feel really weak, like you feel like you could pass out, if you can't keep food or fluids down, or if you're having bad chest pain. Those are all good reasons to call 911. And everyone from the paramedics and all of the emergency department staff are trained on how to keep themselves safe, as well as how to keep you safe if you do end up needing to go to a healthcare facility. And I will go ahead and pass it on to our next panelist.
All right, Dr. Sicker. Dr. Sicker, we can't hear you.
Sorry, I was on mute. I'm going to just pick up where Dr. Batra left off at the 911 medical emergency before we go into testing. Just really quick to make a comment that it's really important to also consider your symptoms that may not be related to COVID and reach out to your doctor. So if you have a history of diabetes and you don't have enough insulin, you need to call your doctor and get a refill of that medication. If you have heart failure and you're on a water pill, you got to keep taking your water pill, otherwise you're going to end up in the ER. So those are really important reasons to reach out to your doctor. If you think you're having a flare-up of your disease, like chest pain, maybe you have a history of a heart attack and you're having chest pain, or your legs are getting really swollen and you're really short of breath because of your heart failure getting worse, you should not stay away from the emergency room. If you feel like you're having a stroke, if you have a twisting of the face, or an arm or leg is not moving, I know it's scary right now to leave your home, and we've told you to stay at home. And it may even be scary to consider going to a medical facility. But those are medical emergencies that, if we can treat them, can help you have a better outcome. And as Dr. Batra mentioned, we're all prepared to keep you safe and keep ourselves safe. So if you think you're having a stroke, you should come and let us check you out and make sure you get the right treatment. And we'll make sure that you're kept, in a clean space and away, and to minimize your risk of picking up coronavirus from someone else who might be there. And I'm sure we'll talk more about that later, but I just wanted to take the opportunity to mention that, because I think it's a big concern of all the doctors. We're not seeing a lot of people coming to the emergency room for those types of things that we typically saw them for. And so we don't want people to stay away for those types of emergencies. So I'm going to go back to COVID testing, which is on the slide here. So there are a number of places that you can get COVID testing in the city. And as I think was mentioned before, you do need a doctor's order for almost all of the testing that's done in the city. So you'll want to reach out to your primary care doctor or reach out through 311 and get a telemedicine consultation so that you can get an order. The doctor, there's no guarantee that you will get an order until you speak to the physician and tell them what your symptoms are or what your exposure might be, or even what your profession is. So if you're a healthcare worker, you're working at a nursing home, you're taking care of someone who may be immune compromised, or if you're over the age of 65, you may qualify for a test with very minimal symptoms. So it's really important to talk to a healthcare provider to determine if you qualify for a test. There are a number of places you can get testing done around the city. The one on the slide here is mentioned. We're all working at GW. GW is offering testing to anyone in the city through two mechanisms. One is a drive-through test where you just stay in your car, and the second is a walk-up test. Both of those can be conducted through talking to your doctor and your doctor sending a note to GW, and then the order being placed, and then they set a time for you. It's through appointments only, so they set up a time, you drive through, you're done. It's very quick and easy. And if it's not appropriate for you to drive through, you don't have a car, we also have walk-up testing at a tent, similar format. You get an order from your doctor, you schedule it, you walk in and get tested. Can you advance the slide, please? There are a couple of other centers where you can get testing. So MedStar Health is offering walk-in testing at their urgent care centers. Again, testing is up to the treating provider at that center, but it is available at all of their urgent care centers. GW has three urgent care centers. They also do testing. United Medical Center is doing free testing for DC residents. You need to call, speak to an advice nurse to get the order placed, and then you can drive through and get those tests done at the United Medical Center parking lot, which is very convenient. For kids, you can go to Children's Hospital, very similar to all of the other sites where you need to get your pediatrician's order for a test. And then I just saw on the news this morning, and I actually don't know the address, but there's a new testing center opening up in Northeast DC. It'll be operating a couple days a week. You'll want to check each of these providers' websites to make sure you're going on the right day, or call your provider and then they'll schedule you for the right day when they're open. So that's information on testing. And a lot of these resources are all found at the same website that Dr. Meltzer mentioned at coronavirus.dc.gov. Yeah.
All right, let's have opportunity now, Dr. Alam.
Okay, so as Dr. Sika was talking, so we probably need to go to the previous slide. So for you to get any testing in the city, you're probably going to need an appointment with a physician. They have to place an order for you. Karen, do you mind if we go to the previous slide? So these are the resources for arranging for a telemedicine visit and an appointment, which is a virtual appointment. These appointments in general, in all of these three, can be either by smartphone, a computer, an iPad, a two-way video, or even in some cases by audio only. And it's either an emergency physician or primary care physician will be on the other side, or sometimes a nurse practitioner being supervised also when that will talk to you in these situations. But I want to shed a light on another point, which is you can use these numbers also to get a telemedicine appointment for other problems, like just what Dr. Sika was saying. It's let's say if you are a diabetes patient and you ran out of your medications and you're really afraid to go and visit your doctor in the office, or you have a new symptom and you want to talk to a physician about these symptoms, and you're really afraid to go to a medical facility. So probably this would be a safer option for you. Figure out if you can get a telemedicine appointment and then talk to a physician or a care provider, a healthcare provider, to give you more information on what to do next. So Unity Healthcare has a phone number dedicated for all the telehealth or telemedicine appointments. You can call them at 202-469-4699. MedStar actually has a website portal in addition to an application that you can download from the Apple Store and the Android Store too. And you don't need to be a patient with MedStar to get an appointment with them through telemedicine. And this is open for all the DC patients. As Dr. Sika said, that at GW, we also do have a robust telemedicine program actually led by Dr. Sika. And by calling 202-741-2765, we'll be able to help you getting an appointment, whether it was for COVID-19 related issues or other health problems. And with this, I would yield the mic back.
All right, now we will have Dr. Powell.
Yes, sir. So as I was preparing for this webinar tonight, I received a phone call from my mother, who is now having cough and some diarrhea. So now I'm concerned that she may be at risk for COVID herself. And starting to think through if I need to be with her in her home to care for her because she's well enough to be home and doesn't need to be hospitalized, how would I keep myself safe while caring for her? And how do I also keep those in her community, in our community safe as well? I know that you guys had a session last week with Dr. El Bayoumi from the Rodham Institute talking about the disparities that we're seeing within our community, that the morbidity, mortality among African Americans and folks in color in general is gone up. So it's really important that we understand how we can best keep ourselves safe. The Department of Health and the Centers for Disease Control and Prevention set forth some guidelines about how to keep you safe if you're living with someone who has tested positive for COVID. The one thing that they really stress is trying to limit contact with that person, whether that means being able to isolate the person who's sick to their own private bedroom or bathroom, if possible, and also trying to avoid having people who are visiting the home itself. Really need to pay close attention to those stay-at-home orders that the city has set forth for us, so we're not passing the COVID along to our neighbors and friends, while also keeping yourself safe. In addition, while the person, your loved one is recovering from COVID, hopefully in a physically isolated place within the home, make sure that you're also not sharing dishes and utensils, that you're using gloves and hot water and soap to wash those dishes so that you're not passing COVID back and forth. The same is true for bedding material and towels and washcloths, making sure that those are also washed in hot water with soap while wearing gloves as well, while you're doing the laundry, to make sure that you're not passing the COVID back and forth. And this is also true for electronics. You don't want to use the same phone. A cell phone could carry the virus as well, and if you're talking on it, you can easily share that back and forth. The other thing that we talk a lot about is washing your hands very often. Avoiding touching your mouth, touching your eyes, touching your face, because this is the way that you're going to touch an item that's been infected and touch yourself and get yourself sick as well. Next slide. If you are to be the caregiver for your loved one who's in the home, as I may be for my mother, you want to make sure that you're providing yourself the best chance of not getting sick. That means wearing a face covering, a surgical mask if you have them, or some type of cloth mask or a scarf that you can put around your nose and your mouth while still being able to breathe through it. Make sure that you're wearing gloves while you're in contact with your loved one to avoid contact with any body fluids. And then again, make sure that you're washing your hands copiously. And what's also critically important, because we know that people who live within the same household are at greater risk for also getting the disease themselves, that you need to track your own health. You need to make sure that you're monitoring yourself for a fever, checking your temperature twice a day, seeing if you're developing any of those other symptoms that Dr. Batra talked about, the cough, the shortness of breath, or even the diarrhea, and making sure that you're reaching out for help if you are developing any of these symptoms. You can call the numbers that Dr. Alam spoke of and Dr. Sika spoke of, doing telemedicine or reaching out to your primary care provider to seek medical advice and to know whether you need to go further for medical testing for COVID or if you need to go into the hospital for care yourself. And I do just want to reiterate what Dr. Sika was saying about reaching out for care. If you are having these other chronic conditions that aren't being managed, if you have your asthma or your heart failure, if you're having signs of a stroke or a heart attack, we want you to come to the hospital so we can care for you. We don't want you staying home sick.
All right. I think that's the end of our slide share. And what we'd like to do now is to have opportunity to deal with some questions and answering. We have doctors available now for questions. And if you would please just type your questions into the Q&A box that you find at the bottom of your screen on the webinar, and we will get to your questions as soon as possible. I'd like to open up with just a discussion around masks. There's been so much in terms of a discussion around masks and what masks are effective and which ones are not, and folk are using YouTube videos to make masks themselves. And I was just wondering if any of you could begin to share about what should we look for if we have to make a mask, or if we're have opportunity to purchase a mask. What should we be mindful of? Who would like to take the question?
Sure, I can address that question since I was mentioning masks before. So we're learning a lot about different types of masks. So everyone's hearing about these N95 masks that healthcare providers are in desperate need of. That's part of our PPE, or our personal protective equipment. These masks are very tightly fit, and they have to be what we call fit tested to make sure that we're not breathing in germs while we're wearing them. These are the type of masks that prevent us from getting sick while we're caring for someone who is ill. These masks are not readily available to the general public. What we are recommending, and what the CDC is recommending, is the use of some type of cloth or a surgical mask that prevents you from spreading the disease to other people. So if you're wearing a cloth mask, this prevents your cough, your sneeze, or what you're breathing out from getting onto other people and getting them sick.
All right. Thank you so much. Feel free to send your questions in. There are a number of opportunities for us to share. Are elderly people and those with ailments at risk of COVID-19? Are only elderly people and those at risk of COVID-19? Who would like to take that? The question again is, are only the elderly and those with ailments at risk of COVID-19?
I can take that. Okay. So no is the short answer to that question. Really, anyone can get COVID-19, whether you're 100 years old or whether you're 1 day old. We do know that certain groups are more likely to get very sick if they get COVID-19, meaning you might be just as likely to get it if you're young, but you're more likely to end up in the hospital or end up in the intensive care unit, or even end up dying from the disease if you are elderly, or if you have other medical problems, particularly things like diabetes, heart failure, lung problems like asthma or COPD, even high blood pressure. All of those things make it more likely that if you do get COVID-19, then you might have a more difficult course and a harder time recovering from it.
Okay. I did want to also ask, I guess, along those lines. We're seeing an increased number of younger persons getting COVID-19. What can we do to prevent a second wave of those who are more active and remaining in public space quite a bit, and could be walking around and be asymptomatic? How are we going to find those who may be under 40 that believe that they won't get it, to prevent them from spreading it and creating a second wave of this particular pandemic? Who would like to take that?
Start, and you guys can add to it. I mean, the first thing you have to recognize is it doesn't matter what your age is,
Right.
As to whether you have the disease or could be spreading the disease. And we do know that some pretty significant percentage of people are asymptomatic. We think it's somewhere in the 20 to 25% of people could be asymptomatic. So that means you have no symptoms, and you could be someone who is contagious to other people. And so if you're out and about and doing your work, or going to the grocery store, or doing other activities, what are the things that you can do to minimize spreading the disease to other people? Well, they include really good hygiene, right? Don't touch things that don't need to be touched. Don't touch your face, your eyes, your nose, or your mouth. Wear a mask. That mask protects you from spreading droplets to other people or spreading droplets to other surfaces that people might touch and then touch their face or eyes or mouth. So it really comes down to being very thoughtful that you are part of a community and that you could be someone who's spreading the disease yourself. I think all of us do this. As physicians, we think we're at increased risk of being exposed because of our jobs. And, you know, I'll just tell you personally, it feels uncomfortable to wear a mask out of my house, right? I'm very comfortable wearing a mask in the hospital. That's normal to me, right? And, but going out of my house, I kind of feel weird about wearing a mask. And so it takes that extra effort. It takes my wife prodding me to remind me and say, you got to wear that mask because you could be an asymptomatic spreader and you need to make sure you're not spreading it to someone else. And then the other thing she's really good about reminding me is we've got hand sanitizer at our front door. So before we even open the door, we're sanitizing our hands. And after we come into the house, we're washing our hands for 20 seconds with soap and water. I think I'll let someone else comment, but the next step in reducing asymptomatic spread is going to be further testing. And so we can talk further about that as well.
Yeah, I would like to jump in here, and I do want other doctors to speak on this. There's a lot of apathy in the community. Some are saying, yeah, I want to be tested, but there's a considerable population that says, why do I need to test if all they're going to do is have me self-quarantine for 14 or more days? Why do I need to be tested? We don't have a vaccine. We don't have any antiviral sort of treatments or anything. Why do I need to test in the first place?
It's a good question. I mean, this is a community effort, Dr. Curry, and we need everybody, even the healthy people, to think about how they play a role in the community. And it's hard to convince healthy people who personally don't feel like they're at risk that their actions potentially affect others and potentially can lead to increased death. So part of the reason for doing this is just to remind people of that, but that's a really hard thing to convince everybody. When you feel well, when you're with people you know, and you say, they're not sick, I know that guy, or I know her, I'm just hanging out with people I know, and I'm not sick. How do you convince them that their actions affect everybody around them? And it's a challenge.
So that leads me to another question, and I just thank you, and any of the doctors on the line can begin to answer. This is from one of our attendees. They say, how will one know how safe that the testing site is, and whether or not the testing equipment is safe, and what should one expect in being tested? So how safe is the testing site and the equipment, and what should you expect when being tested?
So I can answer that question. I was actually tested at one of our testing tents on Monday after having the sniffles myself. And I was a little concerned given work exposures. I was tested negative, and I'm thankful for that. But the testing process was actually really straightforward and easy. But there was a referral made for me to get tested. I showed up in the morning at my appointment at 8:40 in the morning, and I registered. It was done outside. There was social distancing or physical distancing of at least 6 feet from me and from the other people who were registering me and those who are also waiting to get tested. I was taken inside of the testing center, which is a tent that's set up outside of our medical faculty associates. And there was a small waiting room, again, with 3 chairs that were also placed at least 6 feet apart, and everyone who was in there was wearing a mask. The healthcare providers who were testing were wearing full PPE so that they weren't getting sick from us and we weren't getting sick from them. They also took my blood pressure with the equipment that was that had been cleaned and sterilized. And the testing swab itself, while not pleasant, I would say, was sterile, opened from a new container. It was placed in my nose, twirled around for a few seconds, and that was it. The whole process took about 10 minutes with me as a walk-up. And I got my test within, our tests are coming back within a couple of days. It's a pretty straightforward process, and I felt safe while I was there.
So I have a question, and I believe the question has come from Facebook and is also from one of the attendees. And it's saying that I'm about to return to work, which is in a hospital. Should I undress before entering my home in the foyer? And also, should patients diagnosed take medications used for malaria? So that's two questions that came from one person in Facebook.
I can jump in on the first question. We don't know enough about this disease to really know what the best thing to do is, but from what we know so far, we do think that we can transmit it by touching something that has the virus on it, like we were talking earlier about cell phones and things like that. And so if you are working somewhere where there's pretty likely to be patients who have COVID-19, the safest thing to do is to try to not bring any of those possible germs into your home where other people are living. So I can tell you what I do. I, of course, work in an emergency room where I take care of patients with COVID-19, and then I come home and I have a 1-year-old and a 2-year-old who has asthma, who won't socially distance from me no matter how hard you might tell them to. And so I undress right at the entryway, and I'm lucky enough to have a basement access where my kids don't go, and I put my stuff straight into the washing machine, and I go straight into the shower before really touching anything as much as I can help it, or going near my family as much as I can help it. And then once I've showered, the important thing to remember is that if you touch things on your way in, it's possible that they could have COVID-19 on it. So it's important to go back and wipe all of those things down with any type of cleaning spray, it's something like a Clorox wipe or anything like that. And then, as Dr. Powell mentioned earlier, all those tips for living with someone who has COVID-19, you might not need to follow all of them, but you should still keep some of those in mind, even if you don't have it, if you're someone who might be exposed, because you could be an asymptomatic carrier. So things like trying to avoid touching your face, trying to avoid sharing utensils or plates, and washing your hands really frequently are just good practices for all of us at home if you live with anyone else in your house.
So I'd like to sort of follow up on that, since you mentioned washing your hands and the utensils and whatnot. Can you reuse gloves if you clean them with soap and water?
I see Dr. Powell shaking her.
I would say no.
Okay. I think that's pretty clear. But I think it's a question open in the community.
Yeah, I want to add one thing about the gloves. I do see a lot of people wearing gloves out and about, and that could actually work against you over time. So the problem with that is that we don't tend to wash our gloves, and we don't know if they're getting clean in the same way as when we properly wash our hands with soap and water, rub them together really well, wash your hands for 20 seconds, or use hand sanitizer and allow them to dry. When you do those things with your hands, it gets rid of all the germs that are on your hands. The problem with gloves is the germs will just stay on the gloves. And then, when you take them off, you might end up getting it on your hands, or when you put them back on. And if you touch your mouth or your nose with those dirty gloves on, then you could potentially give yourself the disease or pass it on to someone else. So in most cases, it's going to be safer for you not to wear gloves and really focus on washing your hands with soap and water, and not touching your face. If you know you're touching something that has COVID-19 or likely does have COVID-19, then go ahead and wear those gloves, but throw them away after.
Okay.
Yeah, that's what I do at the grocery. Wear the gloves. And then disposable gloves that you can throw away after the grocery shop, because you're going to be touching lots of different things, and then wash your hands once you throw away the gloves.
Okay.
Right. And additionally, what I have observed in the public, a lot of people are using these gloves and at the same time touching personal devices. Like, for example, they would take their phone out and call. If you think that these gloves are dirty, then you are probably transferring whatever on these gloves to your phone. So you have to be mindful of that too, because once you take the glove out, these gloves out, and then touch the phone again with your hand, whatever was on the glove is on your hand right now.
Right. So I did have a question. I asked it as part of a question that came from Facebook earlier, but it's also from one of our attendees. Should patients diagnosed with COVID-19 take medication used for malaria?
So I can take that. The medications you're referring to, you've probably heard quite a bit on the news and on TV, are hydroxychloroquine or chloroquine. Those are malaria medications that have been used for a long period of time. There was initially some thought that it might be beneficial in treating COVID-19. None of the research so far has shown that it's necessarily beneficial, and there are more research studies that are going on right now. You should not take a medication for treating malaria by yourself ever. It should only be under the direction of a physician. So if your doctor discusses this with you, the risks and the benefits of using of any medication, and once we figure out which ones are the best ones to use, those conversations will be more meaningful. But you know, I think we've heard some reports of people thinking that these medications, which sometimes can be found in off-label or non-traditional places, can be used to treat COVID, and then have become very sick or even died from using these medications. The malaria medications can cause heart problems, abnormal heart rhythms, and many other side effects. So you should not take this medication unless it's under the direction of your doctor.
All right. If your diabetes is under control, are you still susceptible to the virus?
I can take that one. We're all still susceptible to the virus. If you have, you know, an eyes, nose, and mouth, and you have fingers, and you can touch something and someone can sneeze on you. But patients with comorbidities, and especially uncontrolled comorbidities, are going to be at increased risk of having bad outcomes from the virus. So you want to keep yourself in the best shape you can, because if you get the virus, you want to survive it and you want to do well. So controlling your high blood pressure, controlling your diabetes, making sure you stay active, making sure your weight's under control, making sure you're eating nutritiously, all are the best things you can do right now. And we're desperate for treatment. I mean, we hope that we could have used this hydroxychloroquine, but right now it doesn't seem to work. But I know that every single doctor and every single scientist is looking for a treatment. And as soon as we know one that works, nobody's going to be holding back on this.
Okay. Well, thank you so much. We have a question from Mike T, who says, there seems to be new findings of connections between the disease and blood clots that can cause strokes. Are you seeing this in your practices? If so, how are you treating this? Who wants to take a shot at it?
I can take a shot at it. There have been reports of this being the case, that there may be some type of propensity to increase the risk for clotting associated with this infection. It's still, we don't know everything about that yet. Just being very sick or ill or in the ICU also increases those risks. And so I think there's still more research to be done. That being said, I think those strokes or any complications of clots will be treated in the same manner that they'd be treated if there wasn't COVID-19 going on. There are protocols in hospitals that are evolving daily to minimize the risk of these types of complications.
Okay, thank you so very much. A question that's come in from Facebook. Since it's been now proven that the disease came from an animal, and it has been identified with human beings being able to transmit it to their pets, can the infected pet now infect the owner? So they're asking whether or not, since the disease has been transferred to animals, and that's been clear, are human beings able to transmit it to their pets, and then their pets infect others?
I can take a crack at this question. I know that Dr. Fauci in the press conference yesterday actually did address this question specifically, and he said that there is no data to date that shows transmission from a pet to a human of the disease. If you're looking at the DC Department of Health and their recommendations for, again, living with someone with COVID, out of an abundance of caution, they do suggest that if you are sick, that you should not be caring for your pet, and that someone who isn't sick should be, in the rare case that you get your pup or your cat's infected. But again, there's no data to date that shows transmission from the pet to a human.
Okay.
I just want to add on to that, if I could, Reverend Carr, just for a second. I think that the last couple of answers really kind of highlights the fact that we're learning about this disease every single day. And, you know, it could be that if we did this same panel a month from now, we might be telling you different things. And it's not because, you know, we don't know what we're doing exactly, or because, you know, people are withholding information. I think right now the whole country and the whole world is seeing close up how science progresses. This is the normal way that we learn about diseases. It's just that usually it happens over, you know, decades and longer periods of time, and not so much in the public eye. And this, because it's so widespread and affecting so many people, it's happening more quickly. And it's happening, you know, with everyone watching, which is not a bad thing. But it sort of highlights that every time we learn new information, we're taking that in. And so if things change over time, it's simply because we're getting better and better data and learning how to take care of this disease.
Yeah, yeah. Thank you. And thank you also for offering to have another panel a month from now to really show us how science is progressing. So I'm excited about that. There's another part of a question that has come from Facebook that's very interesting. And it's around the impact of summer UV rays on the residence time that viruses stay on surfaces. Can any of you speak to that? Is there any validity to this? Oftentimes we think about how temperature, high temperatures and those sorts of things impact various diseases and viruses and what have you. And so what about UV rays and their impact on residence time as they stay on surfaces?
Anyone? I can try to address that. So, you know, I think we do think that kind of the basic tenets of science still exist even around coronavirus. And there is, I think there's some thoughts that the sunlight, natural sunlight, does have an effect on killing some germs. There was, I think, some very early reports from China a while ago that I'd read that may have also suggested that they had found the same thing. However, we're not recommending that sunlight is going to disinfect a surface. You know, getting fresh air and sunlight is therapeutic in and of itself for you. We're all stuck at home and living in my basement. You know, it's dark, it's dreary. And so it's healthy to get sunlight, and that will make you feel better. It may help with some other medical conditions, actually. However, it's not adequate to sanitize a surface or to kill all the germs on a surface. So you still want to use the appropriate types of cleaning solutions for all surfaces, even if it's in the sunlight.
Okay, all right.
Yes, actually, in addition to that, actually, the WHO has a very great Mythbuster page where they talk about all of these things in detail, and they still don't recommend that you let your stuff out in the sun and use things then that it has been sanitized. The CDC also has published a couple of articles about this too, and they do have some really useful resources about more answers for such questions too.
Okay. Okay.
I think the other thing to add to that is the natural extension of that question is, will this go away in the summer because the temperature is going to get hotter? And we don't really have any evidence that that's the case. We know that countries that are in tropical areas do also are part of this pandemic and experiencing spread of disease. So there's no evidence that this will just disappear in the summer because the temperature goes up.
What makes this this particular virus so strong or robust that it can withstand, you know, extreme temperatures? It seems to know really no bounds. What is it about this particular virus that does that?
I can start.
I think honestly,
or go ahead.
yeah, I think honestly, just being part of the coronavirus family is part of that. So corona family includes also the flu. The flu is a very strong virus, and it keeps shifting every year. And we're still struggling with the flu, right? A lot of people are dying from flu everywhere worldwide. So part of that is the genetic composition of this virus and being from the corona family. We have seen multiple coronaviruses show some kind of high infectivity pattern, like the Middle East coronavirus. But this virus seems to be even more aggressive.
Okay, okay.
I think the other thing to add here is that this is a new virus. It's a new exposure to humans who have no immunity from previous exposure. We have no vaccines. And so it's still going to be very important for us to get our flu vaccines in the fall. And it highlights the protection that we get from all of our childhood and routine vaccines. That we don't live with pandemics because of all of the great science that has gone into developing very effective vaccines. And we hope one day we'll have a vaccine for this infection as well.
Any hope with regard to current trials that are going on? Perhaps any timetable that you can speculate on or maybe say anything about? Is it 2021 that we're looking at, or 2022? How long will we have to adapt? Do you have any idea?
I think we can probably say that 2021 is the earliest that we can expect to see something. You know, we're not going to see a proven vaccine in 2020 simply because it takes at least that much time to prove a vaccine, let alone to develop it and make sure it's safe. I think we all hope that we'll see something in 2021. And that's assuming that everything goes right in the development, meaning scientists can get a vaccine, show that it's safe, and then start to show that it's effective. But, you know, with any experiment, if things don't work out the way that you hope they would, then you try something else. And if we end up needing to try something else multiple times, then, you know, it may get delayed past 2021 and could be 2022, could be later, you know, so I think we really don't know.
And Robert Curry, I think the other point to make as well, if we're expecting that we may have a second wave of this in the fall and early winter of next year, at the same time, we're also going to be experiencing a flu epidemic, that we would encourage patients to actually get vaccinated against the flu, because that would make it less confusing about what their symptoms actually represent, whether they're representing the flu itself or whether they could be experiencing COVID. And so if we talk about the surge of patients that we may see, if people are able to keep themselves healthy and keep themselves able from getting the flu, then that will give us an easier chance of combating the second wave of the coronavirus of COVID-19.
Okay. And what about those that don't have insurance? Is there, you know, something that can be, that we can say that would help those who don't have insurance and find themselves in need of a COVID test or even the flu vaccine?
So for COVID testing, I think Unity Clinic has offered COVID-19 testing for free in the city, as long as it gets as long as you get an order from a healthcare provider. Mm-hmm. And I'll let the team answer the second part.
I think
go ahead.
I was just going to add on with the testing. My understanding is the testing in the parking lot at United Medical Center is also free.
Okay.
All DC residents. Like all of the other sites, you do need a doctor's or a nurse's order to obtain that test, which is, you know, relatively easy to do through calling 311 or those hotlines. In
Okay.
terms of the flu vaccine, I don't know all the answers, and perhaps some others do, but many of the drugstores that offer flu vaccines, like CVS or Walgreens, you can get that at a flat rate that I think is usually around $30. I don't know if DC has other options though for free or low cost vaccines for the flu.
Yeah, that's something we'll have to contend with in the community, because even $30 would be prohibitive for some.
Absolutely.
Just a couple of quick, there are several other questions that are coming in. These two I'll take together, and they're safe. Can you reuse the mask? Any mask that you get, can you reuse them? Should you reuse them? Anyone? Should you reuse masks?
Yeah. So
If it's a cloth mask, then you should have a process to, after wearing it, bring it home and wash it. Oh, it looks like Dr. Powell has one there. Show us.
My neighbor made me a mask. So I throw this in the washing machine at the end of the day, throw it in the dryer, and then I can iron it and reuse it the next day.
Okay. Okay. What is your mask made out of?
It's
Yes.
cotton.
Okay. It's cotton. In any material or construction we should stay away from?
So the CDC has actually a very good PDF file on how to make your own mask, and they do advise using cotton or any kind of fabric that is light, and they do have like detailed instructions, like the size, how many inches and everything, and also some instructions on how to clean them and how to reuse them appropriately and store them.
Good. Another short question was, is it safe to donate blood at this time?
Yeah, it is.
Go ahead, Neil.
Yeah, it's absolutely safe to donate blood. I mean, I think, you know, there's actually a large need for blood right now because people aren't out and about and doing normal blood donations. So I don't believe, and you guys can clarify this for me, I don't believe that they are requiring any kind of pre-testing, like COVID testing, prior to blood donations. I think you can just go walk in and do normal blood donation.
Okay.
Yeah, they are testing the blood at that time to ensure that it's not infected with COVID-19. And most of the blood drives, you need to sign up in advance, and you can do so. If you look at the Red Cross website, it lists all of the local blood drives. What's really great recently is that in the past week or two, I know I've looked at a number to donate, and they've all been filled up. Which is good. However, we need to sustain that. And part of the reason they're filled up is because they are trying to keep everyone safe, and so are having fewer patients so that they can be spaced out. Everyone stays 6 feet apart, and that proper precautions are taken for everybody. And so I think that there's going to be a continued need. And so if you're able to do that, continue to look at the Red Cross website as a good resource.
Okay, good. Question from, go ahead, I'm sorry.
I actually have to take off. I have a business class in like a minute from now, but just adding, we here at HealthDesk, we're at the website, we're uploading a ton of resources for the community, including these resources from the CDC, from WHO, from the Red Cross. And additionally, we started doing our HealthDesk shirts that we plan to target this toward some questions and some concerns related to COVID-19. We will continue updating all of these as we go weekly. So for whoever is listening here, if you want your beloved one or anyone in the city to get more information about COVID-19 and the status, you can always visit our website. And thank you so much for having us. Really appreciate that.
Thank you. We did have, thank you, and we appreciate you, Dr. Alam. We do have 3 more questions we'll take and we'll ask briefly for the doctors that remain before we conclude. And the first one is from one of our Facebook viewers. It said, if a person dies from COVID-19, how long does the virus remain on the body before the funeral home can safely handle or remove the body?
Does anyone know the answer on that?
I don't know the answer.
I don't know.
Seen any good studies on that question. So I don't know.
Okay. All right. Well, good question. We'll have to try to look up and find the answer to. Another question from Facebook is, can you share some lung exercises with those who are on this webinar? Because it's been shared that if one is infected with the virus, we should exercise our lungs and move around even if it hurts. So I hear a couple of things in that. One is, you know, when you're infected with COVID, you should do lung exercises, and it will help you some way, even if you find out that, you know, it's painful to do so. Are there breathing exercises, lung exercises?
Sure, I can try to address this question. It makes me think of a few things. I know there have been some Facebook messages going around that even my aunt sent to me probably about a month or so ago that suggested that by taking deep breaths in, and if it hurt or caused pain, then it may show that you are actually infected with COVID. And I just want to make sure that people understand that that's not the case. That's not how we can rule in or rule out a diagnosis of COVID-19. In general, when people are sick or if they've been sedentary for some time, it is important for them to take in deep breaths to try to reduce their risk of developing a pneumonia. Sometimes we have a little device called an incentive spirometer that people can breathe into. And all that really mimics is just taking deep, slow breaths in and then slowly breathing out. What you can do is do those exercises while watching TV. You can do them 5 times at every commercial, perhaps. But again, I don't know that there's any great data that shows that it won't prevent you from getting COVID, but it may help you to be more active in some ways.
Okay.
I'll add to that, just that, we have in emergency medicine, we have a culture of always going to work when we're sick and always being there to care for our patients. And sometimes we don't think about, oh, we're sick, we might be able to spread an infection to another person. And especially before COVID, we didn't worry about it too much. Good hygiene made most diseases not that transmissible. However, I think what's important to remember is when you're sick, you need to stay at home. And when you're sick, you need to rest. I think all of us have seen through our training and through our practices that there is a small percentage of people who get worse from overdoing it when they're sick. And so rest is a really important component of getting better. Keeping an eye on your symptoms is really important, and conveying that with your family and your caregivers so that everyone knows how you're doing is important, because we don't want you to be sick at home and getting worse without anyone knowing about it. But what I'm saying is, you don't, because running a marathon, going out and jogging when you're sick, those types of exercises are not going to benefit you. Resting at home will benefit you.
That's good. That's good. Thank you. That's very good. The last question I will ask is, what would you say to someone who believes the pandemic is being exaggerated and people should just return to business as usual, their regularly scheduled routines? So we'll use that as our final question.
I think what I would say, I would talk with them about the experiences that I've had personally, either caring for patients and watching them pass away within 4 days of coming into the hospital, or getting a text message from one of my medical students who quickly flew out to be with her parents in the Midwest after her father became ill, and then her mother became ill, both elderly and currently in the hospital, and how she's having to try to manage that while she's also managing and caring for her young kids who are back home. This is not a hoax. It's not being exaggerated. It's not made up. This disease is real, and in fact, it's impacting our community more so than I anticipated it would. And so I want to make sure that we're taking this seriously and doing everything we can do to protect ourselves.
Yeah, yeah. Thank you. Anyone else? Should folk return to their regularly scheduled programs? I heard you, Dr. Powell, say, you know, we need to exercise abundance of caution and take it seriously because this is not a hoax. What about reopening society as we know it, and the plans that are going on in various states and locales regarding that? What should we do? Because folk will have to start going back to work. And what precautions should we take? How shall we consider, you know, what new life is going to be, as opposed to going back to a routine where we were sort of carefree and not very mindful of this particular virus?
I think from DC itself, and listening to Mayor Bowser, I believe that her decisions are going to be made based upon science, but also recognizing the economic impact that COVID is having in our city. And so I would trust her leadership, and trust the leadership of the Department of Health and what they're telling us. I, as much as anyone else, want to get outside and enjoy the sunshine and, you know, go to my favorite places in town, but I know that we need to wait to do that safely. So I'm trusting the leadership of our city administrators, and prayerful that that they're being led to make the right decisions for us. In terms of the other cities, I hope that they're also following the advice of the scientists, and that they're not doing anything that are going to put their populations in jeopardy.
Yeah, that is no doubt my prayer as well, and we will trust the leadership of this great city, Washington, D.C., and all of those who are in the District of Columbia, Maryland, and Virginia. We're just really mindful and prayerful that we can do the right thing. So I just want to thank all of our doctors who have come on. I'm grateful for Dr. Meltzer, Dr. Batra, Dr. Sika, Dr. Powell, and certainly Dr. Alam. You have done a great service to our community today. We thank you for what you're doing on the front lines every day, working with COVID-19 patients. And we are just so thankful that people like you are working to make sure that we can remain healthy. We also thank all of the scientists and researchers who are working on various vaccines, and those who are in government agencies. And I just hopefully will have an opportunity to have some dialogue with you all again around this particular matter as we learn more, because this is so very important, and it will touch the lives of a lot of people in not only this region, but literally in this nation. So thank you so very much, and we are so glad you were with us on this webinar today.
Thank you, sir.
Thank you.
Thank you.
Thank you. All right. Be well all, and thank you. And we look forward to further partnership between the HealthDesk, which is George Washington University Medical Faculty Associates, as well as the Pennsylvania Avenue Baptist Church. We look forward to meeting you again and offering you credible, reliable information that's going to hopefully educate you and make you aware of what we're contending with. Thank you so very much, and have the greatest day in the world. Be blessed all. Take care.